Hi, I'm Mariana Harms. I'm a licensed marriage and family therapist at Calm, and I'm also here on behalf of the Pediatric Resiliency Collaborative.
Hello, I'm Barb Finch with the Department of Social Services, where I lead the Kids Network and Resilient Santa Barbara County. We're here today to talk to you about ACEs and toxic stress, how understanding and responding to ACEs and toxic stress can help you respond to the needs of your students. So what's all this talk about ACEs? ACEs have been identified as the single greatest unaddressed public health threat facing our nation today, in the words of Dr. Robert Block, who is the former president of the American Academy of Pediatrics. The ACEs Aware Initiative is a statewide initiative that was launched by the Department of Healthcare Services and the Office of the Surgeon General. It's a first in the nation effort to screen patients for adverse childhood experiences and in order to help and improve and save lives. It's part of Governor Newsom's California for All initiative, and it's striving to create a better world for children, families, and communities, working together across sectors to prevent and address the impact of ACEs and toxic stress. The mission of the ACEs Aware Initiative is to change and save lives by helping healthcare providers understand the importance of screening for ACEs and then training them to respond with trauma-informed care to mitigate the health impacts of toxic stress.
So what are ACEs? You've been hearing us use that word a little bit. ACEs, you're probably familiar with it already, and you might know it's short for adverse childhood experiences. When we're talking about ACEs, we are referring to 10 specific childhood adversities that would have occurred to a child between the ages of 0 and 18. And these include physical abuse, emotional abuse, sexual abuse, physical neglect, emotional neglect, or one of these 5 household challenges: having a caregiver or a family member with mental illness, living with intimate partner violence in the home, parental separation or divorce, parental substance dependence, or caregiver incarceration. I'm often asked, what about other adversities, such as the pandemic? Of course, those put people at risk for experiencing toxic stress, but they're not considered one of the 10 ACEs because there simply is not the robust data like the types that we have on ACEs and its correlation with other health outcomes. So when we're talking about ACEs, one of the things that we're referring to is a landmark study published in 1998 by Kaiser Permanente and the CDC, where over 17,000 adults in Southern California were surveyed. And this is considered one of the largest investigations of childhood abuse and neglect and later life health and well-being. Subsequent studies that have been conducted on ACEs and their effects have corroborated the findings of this landmark study. What we did find out from the 1998 study is that ACEs were prevalent. Specifically, about 2/3 of the respondents had at least one ACE. And if any one ACE was experienced, there was an 87% likelihood of an additional ACE being endorsed. You might already know that ACEs are associated with increased behavioral health risks. That can include smoking, alcohol abuse, illicit drug use, use of IV drugs, depression, anxiety, difficulty controlling anger, risky sexual behavior, panic reactions, and perpetrating intimate partner violence. It's no wonder that Robert Block referred to ACEs as the single greatest unaddressed public health threat facing our nation today. What you may not be as familiar with is the physical impact of ACEs. We know, once again, that there are correlations with ACEs and the risk of mental health outcomes. But now we also know that there is a correlation between ACEs and physical health outcomes. It's important to recognize that these ACE-associated health conditions can impact lots of areas of physical health, such as cardiovascular disease, asthma, headaches, and even cancer. Something else that might be new or potentially a review for you is that while ACEs do affect all communities, there are notable differences in ACE prevalence and ACE-associated negative health outcomes among individuals who are or who belong to one of these groups: women, low income, LGBTQ, or BIPOC. And so my question for all of you watching is, how does your school, or even more specifically, your classroom population, reflect these identified groups? Now, it's important to note that ACEs in and of themselves don't cause the risk for health outcomes or behavioral health outcomes. The culprit behind the increased health risks is something known as toxic stress. And here's the definition we're using. A consensus of scientific evidence demonstrates that high doses of cumulative adversity experienced during critical and sensitive periods of early life development, without the buffering protections of safe, stable, and nurturing relationships and environments, can lead to long-term disruptions of brain development, immune and hormonal systems, and genetic regulatory mechanisms. This is the condition known as the toxic stress response. And I've highlighted and bolded that phrase in the middle because teachers and school staff and personnel can provide those buffering relationships and environments that can really be key in preventing or mitigating the effects of ACEs and toxic stress for your students. And one way to build these relationships with students and provide these nurturing environments is by bolstering resilience in all the students. Here we define resilience as the ability to withstand or recover from stressors. And resilience results from a combination of both intrinsic and extrinsic factors, like those safe, stable, and nurturing relationships we talked about a moment ago, as well as predisposing biological susceptibility. One framework that is very useful to look at is the 7 C's of resilience. This is a framework that was developed by Dr. Ken Ginsberg, who partnered with the American Academy of Pediatrics to write a parent's guide to building resilience in children and teens. Here he identified 7 areas of resilience that caregivers can work around to help their children boost their resilience. Here are the 7 areas: competence, confidence, connection, character, contribution, coping, and control. There's lots to be talked about and unpacked here, but this is just a preview of the full presentation. We will look forward to doing a deeper dive with you on all of these topics. And now I will hand it over to Barb again.
So when you look at those 7 C's of building resilience in children, we recognize that while children are with school personnel and teachers for a good bit of the day, they're also in other places. And so we want you to know that schools are not alone in attempting to build resilience in students and in their families. In Santa Barbara County, we are working to build strong networks of care that are ACEs informed and trauma responsive, resiliency focused, and that include multidisciplinary partnerships. We want improved access to the evidence-based buffering resources and supports that we know help to address the impacts of toxic stress. And so you'll see on this slide, the buffering stress wheel, the stress buster wheel that was created by the Office of the Surgeon General. And it identifies 7 different types of buffering supports that can really help with toxic stress. And so the organizations that are involved in this ACEs and resilience movement may have one or more of these services or these strengths to their organizations, but these are also things that you can think about incorporating into your classrooms. So first and foremost, as Mariana mentioned, supportive relationships are something that anyone can offer to a child, whether it's a parent or a teacher or a playground supervisor. Supportive relationships are really important. Things that usually don't happen at school, except maybe with the young children: quality sleep, balanced nutrition is part of every day, and physical activity. These are things that also support the buffering of the toxic stress response. And then the last ones, mindfulness practices and access to nature, and then mental health care for those who need mental health services. So these are the buffering supports, the stress busters that are being worked into children's programs throughout our community, not just at school, but also in after-school programs and other places that children and families go. And so I mentioned this fact that you're not in it alone. Resilient Santa Barbara County is a network of networks, and within each of those networks, a network of organizations. And so the Kids Network is multi-sector, the Network of Family Resource Centers, the Child Abuse Prevention Council, the Maternal, Child, and Adolescent Health Network, the Promotoras, the Juvenile Justice Coordinating Commission. Many of these networks are well-versed in ACEs and toxic stress and paths to resilience. So representing all of the sectors and many of the organizations in our community, we're committed to building strong partnerships so that none of us has to do this work alone, and we can all begin to heal our communities together with one another.
And I think that's it, right, Barb? We intended for this to be a preview. We hope that you will join us when we do the full presentation and we do a deeper dive into all of these topics so that you can walk away with some really helpful tools and practices to build resilience in your classrooms and your schools.
We hope you'll check out the handouts that we sent along. There's additional information there if you're interested in this topic.
And here are our references, which will also be in the slides available to you. Okay, thank you all very much.
Thanks so much.
Bye.